I started eventually wearing an SI belt, a sacroiliac belt, all the time to kind of hold it in place because it always seemed to be doing something funny, and that was extremely uncomfortable. It was so tight I thought I'd get varicose veins or something to that effect, and that's when my quality of life went way downhill because I was convinced that that SI belt was necessary because of all the strange things going on with my pelvis, and it was extremely hard to get around with that. Once I was trying to solve that problem, it became intolerable because we were not effectively solving it. My bladder was better, but the quality of life was kind of so destroyed from having to deal with the SI belt and all that it kind of made up for that. And I was at my wit's end, and the neuropathy wasn't going anyplace. My PT had an existing relationship with Jerry Hesch, so she sent me over to him. The first time I saw him, I was sure that he knew what he was doing. It was quite obvious to me from the exam that, yes, these things were out of place, and I felt much more balanced when I left, but my neuropathy symptoms were not better. The second time, when he did that more subtle adjustment in the pubic area, I did feel immediate relief. It's not too unusual for me. Any kind of manipulation usually helped me, so I kind of walked out of there not knowing if it would stick. It did. My symptoms went from a 7 to between a 2 and a 4, depending on the day. And so really, I have my life back. It is a constant part of my life, but it's not to the point where it is my whole life, where I'm running to practitioners constantly trying to solve things, and I have no idea what's going on anymore. It has not taken over my life anymore, so that's been very nice. I'm still pursuing. I went to one practitioner that told me that it can take 1.5 years for the nerve to heal, and so at this point, I don't know if the nerve's just healing, or if it needs more work in some way, if there's some kind of soft tissue restriction, or if, in fact, I have nerve damage that's not going to go away and I'm going to have to remain medicated. So I'm not sure what the situation is, and I am going to get an MR neurography and get that looked into more, but I feel balanced. I don't have a leg length discrepancy. That was a result of how out of whack my pelvis was. Actually, what turned out was the most dramatic thing about Jerry's adjustment of me was that over the next couple of weeks, my bladder got really, really dramatically better, probably better than it's been since, just prior to when I was 14 and I had the initial injury or whatever when I started getting interstitial cystitis. I don't think Jerry expected that, actually. I certainly didn't expect it. I was pretty happy with the function of my bladder where it was, but it got really amazing. It got like a normal bladder and not like an interstitial cystitis bladder, so I was extremely satisfied with that part, and I think that that's something to be investigated further, is how adjustment of the pelvis will affect people with interstitial cystitis. And it did all start when I was 14, and I got the interstitial cystitis and migraines pretty much at the same time, and I have been, I guess, misaligned ever since, and it was never identified. I got x-rays, and they were normal because it was really a function of my physiology more than my anatomy that with what was going on with me. So I really cannot say enough about the Hesch method. It made a huge difference in my life.
Thank you. And I had pulled a couple of anatomy textbooks hoping to show you the course of the pudendal nerve, but I don't think the complexity of that nerve would convey well via a video format, so I can just recommend that you chase down an anatomy book. And I have several of them. I probably own 8 different anatomy texts. It's really necessary to have different views, and it's good to go down the medical library and borrow, at least, even if you can't carry it out of the building, borrow their anatomical models so that you can actually look at it 3-dimensionally. There's so much that you can learn if you can hold the anatomy in your hands and look at where that nerve travels. Not just with respect to the pudendal nerve, but with respect to learning anything about anatomy. And I certainly am a student of anatomy. Yes, I've had some coursework in it, but you can get a PhD in anatomy and they go on and do postgraduate research. It's not a closed science. They haven't discovered everything about it. It is a very active, a very real science, and I have a passion for it. But I'm here to tell you I'm not a PhD anatomist, and I have a great respect for it, enough respect that I know that one needs multiple resources. But do pick up a text or two and take a look through the innervation of that the course of that, especially as how it travels out of the pelvis and back into the pelvis, and you can get an appreciation how one may get mechanical tension or compression on that nerve. And I was pleased that we were able to make a difference in her quality of life with a mechanical intervention designed to balance the pelvis and balance ligamentous stresses. And remember that that nerve does surround and go over the sacrospinous ligament and underneath the sacrotuberous ligament and all the relevant proximal musculature, fascia, connective tissue. Therefore, achieving balance at the symphysis pubis, achieving balance in the sacroiliac joint, in the pelvis, the hip, the low back, and also the lower half of the pelvis, which we've already elaborated on, is in fact relevant. And this concludes our case study on pudendal neuralgia related to mechanical cause from the pelvis and the symphysis pubis and sacroiliac joint. Thank you very much.